In this video, we are going to go over a head-to-toe routine that gives you some awareness of what your joints are supposed to do, what your joints currently can do, and the gap between those two. And it'll also serve as a daily joint care routine that you can use in a very simple way to give a little bit of extra attention for the areas that feel stiff. So what we need to understand first is just what is home base alignment. And we want to kind of use home base alignment to give ourselves that self-diagnostic assessment, right? So home base alignment, if we look at this mainly from the side view, I want to see my ear, my shoulder, my hip socket, the widest part of your hip here, the greater trochanter, and the ankle bone right to the front tip of this outside lateral malleolus is what it's called. And then from that template, we want the rib cage and the pelvis to be stacked. So as a quick assessment, if you felt your hips and you were to just squeeze your butt and you felt them actually tilt backwards, then you would know that your pelvis is not in a neutral position, right? Typically if it tilts backward, it's just a little bit too anteriorly tilted, which means these two bony parts on the front side have tilted forward. And so we don't want to necessarily use the butt squeeze to create the neutral, but we want to create that neutral from a pulling up and in of the low abs without having to clench the deep muscles of our hips, okay? So to find that, right, you can do the clench, relax it, and then pull it in with the abs. And then all I want you to do is take a nice deep breath and exhale to find the rib cage position to match it. Okay? And that should just feel like it gently pulls your ribs down without crunching you. So we want to stay long and decompressed with our spine as we find that neutral base position. Okay? So now we have rib cage and pelvis are kind of like mirror images of each other, an upside down bowl and a right side up bowl. We have our stacking of our ear, shoulder, hip socket, and ankle joint. And now we can move forward with our assessment. From a global perspective, we should be able to reach our arms all the way up, reach behind us with our hips passing our toes slightly, and our arms able to get to ears and beyond without flaring the rib cage or seeing a disconnect here. Should be a nice smooth curve backward. Then I should be able to bend over with relatively straight knees, put my palms flat on the floor. What I look for here is a nice smooth curve in the spine. You can flex your head here. And I'm looking for symmetry as well between sides. So is one hip sitting higher than the other. We also want straight feet here. So remember, straight feet from my definition is second toes are pointed straight ahead. And then I want my pelvis or my sacrum angle to be pointed flat. So if I bend over right here and then I fold here, my sacrum angle is pointed up that way versus being flat and being able to get all access out of your hamstrings before allowing that flexion out of the spine. Okay. Then global rotation. If I go this way, I should be able to rotate this way and look all the way around. And then this shoulder should disappear. And the feet should be able to still stay straight, okay? Global rotation this way. Like that, okay? Then we move on to the squat. So we should be able to access a hip width deep squat all the way down and should be able to rest there. Now some may be able to access this and have to put their arms way far ahead, which I have to do without warm up, but we should be able to get down here as a base, but we should be able to, I'll show you with a little bit of ankle support, we should be able to get down to this position and rest here with your arms on your knees and not feeling like you're going to tip over at any moment, okay? Now, It's okay from a base if you need to go just a pinch wider and just a pinch toed out. That is a much easier position to get down to. But a lot of us, most modern adults have lost that ability as kids. And so we have to have a template to regain that back, and I'll get into that in another video. Then we move joint by joint. So we're gonna start at the neck, and you should be able to bring your chin to your chest without losing any of the alignment pieces. Chin to sky. So chin to chest with your mouth closed, don't reach the chin. Chin to the sky, to the point where the line of your face should get to within 10 degrees of parallel to the ground. Like that, okay? Then from here, you should be able to turn your head to the side, bring your chin to your collarbone without your collarbone coming up. So don't let it pop up, keep it down, like that. You should be able to turn to the left and do the same thing. Okay. Then we have lateral flexion. You can get away with not really paying attention to this and watch how the other movements affect this, but we should be able to kind of keep our nose on the same level, tilt our ear to one side, keep our face angle on the facing forward, tilt our ear so that our face angle makes about 45 degrees, and then same thing, 45 degrees that way. Again, no tilt to the shoulder and no lean to get there, okay? Purely from these top several segments in the cervical spine. Then we move to the thoracic spine, and if we lock this in place, and then if you actually overdo the tucking to lock your low back, your lumbar spine in place, we can get a more accurate assessment here. So we lock this, you can go a tiny bit wider, soften the knees. You're gonna turn your chest this way until you hit a limit. Feet should be able to stay grounded. And then if your fingers stay on the center of your chest and point straight out, they should almost form like a highlight over that kneecap. So if I rotate this way, they should be able to face where that kneecap faces. It's about 45 degrees. If we go this way, same idea without shifting our weight, okay? So if we keep everything in the center and rotate purely around that center, it should look about 45 degrees. Then we move down to the lumbar spine, and it should flex and extend. We've already kind of gone through the toe touch and the reach back, but if we isolate it at the pelvis, we can get anterior tilt, posterior pelvic tilt, like that, and then kind of be able to find that baseline and move. I've got a long history of back pain in my younger years, so you can still see a little bit of a shake here and there at certain points. Then we'll move down to the hips. We've already gone through being able to flex fully with our feet on the ground, but what we want to be able to do is bring this knee up and across and keep it across until the foot matches the knee, and then it should be able to bring up here actively to pass the belly button. Now you should be able to bring it up even higher with your support of your arms, and we want to see a minimal gap between those two pieces. Okay, so this leg goes up and across, stays across. See, this one wants to peel out already, stays across, and then continues lifting past the knee. This one has a little bit tougher time. And you can see there's a bigger dip there. If I bring it up passively and then let go, should be able to kind of hold it there without like leaning back or compensating anywhere else. And you might find that one side has a harder time staying up. I can feel that working a lot harder on my left side. And so that would be an area that I would want to spend a little bit more time addressing. General pattern would be like 10-second holds. I'd do 3 of them on this side, maybe just 1 on this side to try to iron some of that out. Then from the side view, or I'm sorry, from going out to the side, we should be able to stay stacked here and move this hip out to about a 45-degree angle without tilting it, also keeping the midline 45 degrees this way, and then across like that about 30 to 45 degrees as well. Okay, same thing, get a little test. Again, these are just planes of motion, so we're not taking into account how the body is actually supposed to move in spirals. We'll get into that in a later video. Okay, but this just gives us a base assessment. Then we move to the knees, one more area for the hip. We should be able to go backwards about 20-30 degrees on both hips without leaning forward and without extending through our low back. And then we should be able to do that without this foot turning open, okay? We should be able to keep that knee pointed straight ahead and do that assessment that way. Okay, the knee should be able to straighten and bend, and you should be able to passively bring your heel to your butt, okay? And you should be able to do that while the thigh sits at a 90-degree angle. Fully lock out, fully bend, passively bend all the way, okay? The ankle, if we're looking at just the ability to bend, if we look at this back leg, your knee should be able to, here, let's do it this way. This knee should be able to pass this ankle, so it should be able to pass here as a base assessment. And again, we're standing heel toe like you're standing on a line or standing on a curb. And then you want to take note, do you feel pinch on the front or do you feel stretch on the back when you hit your limit there if it's tight, okay? One's a joint issue and needs more rotational opening. One's a muscular tension issue and needs to be kind of reorganized from the foot to the hip. So then we can take the ankle through circles, just big circles like that. Find, do you have any shaky areas? I have a long history of multiple ankle sprains. Got a mound of scar tissue that just sits right there. And so that ankle can get a little bit stiff here and there and kind of needs more blood flow to help keep it decongested. Okay. And then the last thing is up on your toes, right? Okay, so just a base assessment, you should be able to go up on your toes, balance up there, and not have your feet kick out like that or collapse in like that. Okay, balanced across the entire ball of the foot where the tip of the big toe is anchoring into the ground. Okay, then just from a baseline assessment, we want to be able to separate our toes. So our toes should be able to keep all four toes down and lift the big toe. Keep the big toe down, lift the four toes. Lift them all up, put the big toe back down without it curving in. Keep the big toe up, put all four toes down. Splay the toes and then piano key them down, pinky toe. So fifth toe, fourth toe, third toe, second toe, big toe. And then the last one, we should be able to take the first knuckle and retract the foot without the arch lifting up like that. So we should be able to kind of retract the metatarsal heads at the front of the foot and pull them towards the heel without any kind of hammering or anything like that. The first knuckle of each toe should bend. Then the other foot, we got big toe up, four toes down, big toe down, four toes up, all toes up, big toe down. It's a little harder on that side for me. You can use your hand to kind of help with that as well. All toes up, four toes down, piano key, 5, 4, 3, 2, 1, and retract. Okay, you just use this assessment to give you a base on what's the hardest part, and use that to tailor a routine for you. Now we'll go to the upper body. We're going to go through shoulder blades first. So shoulder blades, you can think of this as a box with four corners. They can go forward, which is protraction. They can go backward, which is retraction. They can go upward, which is elevation. They can go downward, which is depression. Now you'll hit all the other motions by arcing your way through those spots. So if we start back and down, which is what most people think of with posture, which is not correct. That's compensation. If we start back and down, we can go back and up, then forward and up, and then forward and down, back and down, back and up, forward and up, forward and down, and then go in reverse. Now the ideal here is that we don't see a loss of alignment anywhere. So if we go back and down and our head pokes forward and our rib cage flares, then that's a compensation, and we want to try to fill this space up here while we do that. So we want to go try to keep your upper ribs inflated, your upper rib cage inflated while you pull these back, and then you might find a more true limit happens here where you can't actually get them all the way together. Back and down, back and up, forward and up, down and forward. But we don't want to feel like we're just mashing our ribs together between our shoulder blades. We want to be able to maintain the contour of the rib cage while we perform those scapular movements. Then we go to the shoulder, just from a base assessment. Arm should be able to go up and go right next to the ear, cover your ear without flaring, and without the head poking forward or without the head going to the side. You should be able to do the same motion from the side, or just get the same alignment from the side. I like to feel my rib cage when I do this one. Up, up. And then you should be able to go behind you. So about 60 or 70 degrees without collapsing forward here, without any loss of alignment. And then we should be able to reach our hand to the opposite side shoulder blade inferior angle, like that. If we combine, should be here, fingers at least. And then I gotta work on this one a little bit. There you go, you can get it. But I'll see a lot of people stuck, and that's like as far as they can get. Typically, if we're that tight, mid-back needs to be addressed first, and then you work out to the shoulders. My general recommendation is to work just like we did. We start at the spine and work your way out, either to the arms first and then, or the legs, but always start with the spine, adjust the spine first. Move to the elbows. They should flex and extend, fully bend, fully straighten. They should be able to do that with both wrist positions. If you held a, see if I got a stick here. If you held a pencil or a stick in your hand tightly, so you'd be able to form a line where like all these knuckles line up with the stick, and you should be able to go to 90 degrees in supination. Imagine like you're holding a cup of soup without spilling it, and then about 80 to 90 degrees of pronation, and we're looking at this angle of your knuckles there, without the elbow flaring, without losing any shape there. Okay, pronation's like prone to spill the soup, right? So supination, pronation, like that. And then we should have wrist flexion down like that to 90 degrees, and wrist extension up this way to 80 to 90 degrees. Okay, and you should be able to do that with a closed fist as well. Okay, flexion, extension, closed fist, flexion, and extension. Okay, and that basically is your head to toe assessment. So I know that can take some time. At first we're just learning, we're talking through it, what should each joint be able to do, but now you have a clear picture on what those things should be able to do and how to use it to create a template for you to adjust the tightest areas and see the whole improve as a result of working on those things. Again, our hierarchy is, if you have an issue in the spine, address the spine first, especially the middle segment with the mid-back. That will affect both the neck and the low back. Then we kind of toe the line between feet and hips being the biggest priority, or like ankles and hips being the highest priority, and then addressing the shoulders from there. Okay, so that is your head to toe assessment / joint care routine, and I hope you gained some valuable insights there.